My name is Professor Shahid Khan. I'm a consultant specialist in gastroenterology and hepatology at Imperial NHS Trust and Imperial College London. I decided to become a doctor when I was quite young, I think about 6 or 7 years old. I didn't really understand why. It's just something that fascinated me. I was always interested in science, and what attracted me to medicine was the fact that you are trained as a scientist. And you can take that knowledge and those skills and the technology to a real human being who needs help and directly apply that. That's always been very exciting to me. Also the fact that as a subject, it's incredibly interesting. It's fast moving, as we've seen with the pandemic, for example, the new diseases, new treatments, new technologies, new procedures. So it's intellectually stimulating as well as very satisfying to the soul, I find. I chose gastroenterology and liver disease because there's a broad range of pathology. So it's not repetitive. There's different types of diseases. It includes infectious disease, metabolic disease. There are some genetic conditions, autoimmune conditions, cancer. So from a pathology point of view, it's very diverse. It's very interesting. It's also, we have lots of effective remedies for many of our the conditions we treat, and that's always very satisfying if you can really help the patient. And also I enjoy the technical aspect, the endoscopy, and again, it just creates variety. It's also a very ripe area for research with lots of advances within this field in the last couple of decades. So it ticks all the boxes that I would want to do. So I was born in London, and I grew up in London and have lived all my life in London. I have traveled extensively, and I've been very fortunate to travel around the world within my profession and conferences and giving lectures and training. But my base has always been London, and I am clearly biased, but I think London is a great city. What I find most rewarding about my role as a consultant in my specialty is when I have a patient who has anxiety, some concerns, and I can help them, or I try to help them. Sometimes it's about reassuring the patient that actually things aren't so bad and this is nothing of concern. But even when it turns out that there is a significant risk to that person's health, just for that patient knowing that they have someone who will be their advocate in the system and their journey, I find very personally rewarding, and their gratitude for that. What patients value most about me, it's difficult to answer. I suppose that's probably an answer best from the feedback that you can read about me from my patients. What they anecdotally have said to me is that they find the way I explain things to them in a manner that they can understand and give them options and involve them in a... So to me, the doctor-patient relationship is a partnership. It's not a paternalistic relationship. So it's about giving patients the information so they can make informed decisions with me as their guide. What I value most about patients, I think undoubtedly it's the trust people put in me, or in any doctor, the trust people put in us, simply because we're the doctor. Patient, I may meet a patient for the first time when I've never met them before, and they will tell me everything about their history. They'll tell me personal details. They'll let me examine them. They'll let me do procedures to them, and that's a huge trust that people are putting in me, or people put in any doctor. And to me, that trust that people put in me is a great privilege, and I value that the most. I think the challenges of my specialty is actually one of the attraction to the specialty. So I said that there's a broad range of pathology, which means that if you have a patient with certain symptoms or certain abnormal blood tests, actually there's quite a lot of things that could explain it. And on the plus side, so the challenge is that, you know, you really have to put your thinking cap on and work through lots of possible diagnoses to come to the right one. But that challenge to me is also an attraction of the specialty, that you have to engage your brain, you have to think, and you have to be a bit of a detective sometimes. Yeah, I think what I try and always remind myself and my trainees and my students, that it is a great privilege to be a doctor, and try and treat every patient you come across as if they were a member of your family, I think. How you would want to be treated if it was you or one of your loved ones.